But I've never doubted Andrew's complete commitment to the same values that we're pursuing when we're bringing our case in court. I just want to say that at a time like this, one can choose whether to emphasize what David Brooks in a column last Sunday. If you have a chance to read this column, it's called Moral Bucket List. It was in the New York Times last Sunday. And he drew the distinction between the resume virtues and the eulogy virtues. And Donna talked some about the resume virtues, and we sort of know what they are. Andrew was a prime proponent and a prime mover in the passage of healthcare reform in Massachusetts in 2006. And it was a Blue Cross forum where Governor Romney came and really threw his weight behind the bill, and we knew it was going to become law. And really, Andrew leading the engineering of all of that, and that's great. We know that he played a major part as an insurance executive in the passage of the Affordable Care Act. And we know that he has been a leader nationally, an innovative leader in shaping the ACOs as a way to contain costs without sacrificing quality of care. Those are the resume virtues, and they're huge. But tonight, I really want to focus on the eulogy virtues. And I know it's premature, but it's better when he's still alive to hear them. Dr. King said, months before his death, he said, well, it's going to happen sometime. But on my epitaph, don't write that I won a Nobel Prize. Write that I tried to love somebody. That's a eulogy. So I've known Andrew for some time. One of his eulogy virtues is not that he babysat Mike and Peter Dukakis' kids. I'm not including that. That's before the start of his career, although that was service that he gave. And Andrew is a service person. He's deeply committed to service. Whether in government or now, service is his thing. Just out of college, reporting for the South End News, he reported on the deinstitutionalization of people with mental illness and how it was impacting the Pine Street Inn. And of course, those are problems that are still with us. We didn't understand quite the magnitude of it and the chronic nature and the lasting impact of it, but Andrew understood it, learned it, and it's been part of his background and experience. When he came to the Dukakis administration, he was there to listen. One of the things I met Andrew in 1983, I knew almost immediately that listening to others was in his DNA. And I think anyone here who knows Andrew and has spent time with Andrew knows that that's the case. He's a listener, an active listener, and in my mind, that's a eulogy virtue. In his years, and Phil Johnston's the Human Services Secretary, I got to know him because he was in charge of the so-called MR consent decrees, Mental Retardation Institution Reform consent decrees, and I had been the lawyer in the Attorney General's office who had represented the Commonwealth then, and as legal counsel to Mike Dukakis. We worked closely on those decrees, and Andrew was a leader there. So those are signs of his commitment. But what I'd really like to do, just as a final part of my introduction, is just tell two little anecdotes about Andrew that I think epitomize who he is as a person. So in 1993, I had this idea that I wanted to change careers and become a healthcare lawyer. I knew essentially nothing about healthcare. It was 21 years ago. Some would say I still don't know anything. It's just 21 years later. But in any event, I couldn't put up an argument at the time in 1993. And I had breakfast. I reached out, I asked two people who I totally trusted intuitively to tell me like it was, to tell me the truth about whether this made any sense for me. One was Dennis Thompson, who was a dear departed friend, and very close to Andrew and me. And the other was Andrew. And I had breakfast with him at the B&D Deli on Beacon Street, now Starbucks, way of all flesh. And I said to Andrew, am I out of my head? Does this make any sense? I'm 53 years old. I really don't know the field, but I just have this feeling that I may be able to make a contribution. But please, tell me if this doesn't make sense. And I remember so clearly that Andrew was so enthusiastic and encouraging. He empowered me really that day. I just went away thinking, oh, maybe I can do this. And I trusted him, although we didn't know each other well. And he just listened and gave me back wonderful encouragement. Here's the other memory I have. It was 1995. Ken Schwartz had died. And Andrew was delivering the actual eulogy at Kehillah, Israel, in Brookline. And I listened to Andrew, and it touched me so much. I wrote down the words that he offered that expressed the uniqueness, the essence of Ken. I wrote it down. I still have that piece of paper with me 20 years later. And what he said about Ken was, people felt safe in his presence. And I thought, oh my God, what a wonderful thing. And it was true, and what any of us would wish to have said about us. People felt safe in his presence. And so tonight, as I was thinking about introducing Andrew, I thought, and that's true of Andrew, that's his essence. People feel safe in his presence. Thank you very much.
All right. Andrew's going to be patient for a moment. In recognition and appreciation of your career, long commitment to educational outreach on important healthcare issues, to providing access to integrated and affordable healthcare for the citizens of the Commonwealth, and to your ongoing leadership and advocacy in responding to the misuse of opiates and other medications while preserving clinically appropriate access to all forms of treatment. We applaud you.
Thank you, Donna. Thank you, MAMH, for honoring me with the Friend and Leader Award. It's such, when you look at the program, there's such an incredible cast of previous honorees. Some who are here tonight, the comparable Loretta McLaughlin, among others, who I had not seen in a while. Last year's honoree, Tim Murphy, who's sitting right here. And Secretary Sutters, who I'm convinced, when Governor Baker chose to put the state's kind of preeminent advocate for better mental health care as the Secretary of Health and Human Services, I knew things were good for everyone who cared about mental illness. Steve, thank you for that generous introduction. You know, Steve could have been any kind of lawyer. Okay, he had already been this prominent government lawyer. I'm sure there were many offers for him to become a judge. He could have been a corporate lawyer. He could have gone to Washington. But instead, he decided to represent those who were most vulnerable, most in need of legal advocacy. He did it for people initially who had problems with the health insurance system. And then after Katrina, he went to New Orleans. He actually moved to New Orleans because he was so moved by the tragedy there. And now in his leadership of NAMI, he's turning his attention to the important issues of mental health. Steve, what an extraordinary career. I want to thank the the great Blue Cross Blue Shield team who are here tonight, especially Ken Duckworth, who is not only a Ken is a leader at Blue Cross, he's a leader in Massachusetts, he's a leader nationally on mental health issues, and we're just so privileged to have him. And finally, I want to thank my family, and especially my wife, Lynn Modell, the stunning Lynn Modell in blue here, who inspires me every day, and I couldn't be doing the work I do without her support. And finally, I just want to thank the association, to Bernie and Tim. I've known both of them for 30 years, and you both dedicated your careers to being thoughtful, forceful advocates, creating great programs, and being voices of the most vulnerable. Where is Bernie? Bernie, where are you? Right there in back. So this is the thing about Bernie. He's in back. He's orchestrating this whole thing. You know, I think one of my first experiences with Bernie, Bernie calls me, say, Andrew, I got to talk to you about something. And, by the time you're done, of course, I'm always writing a very large check. Bernie, if we had sent you to the Middle East 30 years ago, there would probably be peace. You're so persuasive. And they're not in my notes, but I do want to thank my friends from the Schwartz Center, Ellen Cohen, Margie Stanzler, Betsy Frawley, and Jim Litton, because that is such a deeply important part of my work and our work, and it was great that Steve made the connection, so great thanks for So just a few brief thoughts. Everyone here has an experience with mental illness in their life. It's a friend, family member, it's a colleague, it's a neighbor. They've experienced acute issues, chronic issues, substance use. I've learned not to say substance abuse, I'm learning substance use or addiction. And they affect everything. And I've had members of my family immobilized by depression and anxiety. I had a close friend, my brother's best friend, take his own life, desperate because of the mental health problems he faced. But we know if we get people the right treatment, if we connect them to the right caregivers, if we build the right systems of care around them, then we can improve their lives, we can treat these issues, we can support them and their families. But there's no question we're not doing it as we should. And there are so many reasons get cited. It's too complex. There's the stigma. There's not enough funding. There's a lack of medical evidence. There's that tension between kind of biological roots of mental illness and traditional therapy and other interventions. But I'm convinced we can and have to do much better. In Massachusetts, and Steve told in 2006, we made a decision as a community that everyone in the state ought to be covered. That no one should face a barrier to care because they didn't have health insurance. And we were the first and only state ever to accomplish that. And then, several years ago, we decided that we wanted to pay differently for care. That this form of payment, this fee-for-service system that rewarded volume and intensity of care, instead of rewarding quality outcomes, that too had to change. And we are leading the nation on that as well. So isn't it time that this community picked another issue to lead the nation on? And shouldn't that issue be better care and treatment of people with mental health and substance use and addiction problems? We're ready. We have the right community. We have the best caregivers and professionals. We have terrific organizations like MAMH and like NAMI. We have organizations like Blue Cross and others who care about this issue, who want to support this issue. And we have public leaders like Secretary Sutters and Governor Baker who are committed to it. Let's solve this problem together. Thank you very much.